A new confirmed case of Ebola in the U.S. You've learned this within the hour. A New York doctor who recently returned from West Africa is now in isolation at a New York City hospital. CCTV's Jim Spellman is here with me with the very latest. Jim.
It's no surprise, really. Authorities have been expecting more cases just like this, but it's a little surprising that it's a doctor that was treating Ebola patients just within the last 2 weeks or so. His name is Craig Spencer, and he's a doctor who recently worked with Doctors Without Borders, Médecins Sans Frontières, in Guinea, treating Ebola patients. He returned to New York City here in the United States on October 14th. That puts it well within the 21-day incubation period for the disease. On Tuesday, the New York Times reports he was feeling sluggish. By Friday morning, he had a fever of 103 degrees Fahrenheit. That's quite high. He was taken immediately to Bellevue Hospital and placed in isolation. His girlfriend is also being monitored for symptoms. That was earlier today, Friday morning. Within just the last few hours, blood work came back positive for Ebola. The CDC, the Centers for Disease Control, has deployed a rapid response team to New York to assist local authorities. That's something that came out of the cases in Dallas, that the CDC would have this rapid response team ready to go to help not only with treating the patient, but making sure healthcare workers there in the hospital are as safe as possible.
Sure. And, we're talking about New York City here. So what are officials there doing to try to stop the spread of Ebola?
Yeah, it's called contact tracing. It's so important in stopping the spread of this disease. Immediately, public health officials there deployed so-called disease detectives to track down anyone Spencer had contact with, but that may be difficult. We know that Wednesday night, he took a crowded New York City subway from Manhattan in New York City to the borough of Brooklyn to go bowling. He then took an Uber car service ride back to Manhattan. So right there, you potentially have hundreds of contacts just hours before he had a 103-degree fever. Now, the virus is not transmittable unless the person has symptoms. So it's not clear exactly when he was capable of transmitting the disease. And also, Ebola isn't transmitted through the air, so it's not easy to transmit. But these disease detectives really need to track down as many contacts as possible to stop any potential spread of the disease. Trying to track down who he was on the New York City subway with, difficult to say the least.
Yeah, New York City is not Dallas, Texas. All right, Jim Spellman, thanks for that. Mali's health minister says the West African country has confirmed its first case of Ebola. The patient is a 2-year-old girl who came from the neighboring country of Guinea. Mali becomes the 6th African country to report an Ebola case. The World Health Organization said Ebola remains an international health emergency, but advises against a travel ban.
The committee reiterated its recommendation that there should be no general ban on international travel or trade.
The WHO says the disease has killed over 4,800 people and infected almost 10,000.